Working as a new nurse is not what you think, but if you're already planning to go to school, about to start the program, or you're already about to become a new nurse, let me spill some tea to you about your nursing program. It's your favorite 4'10" nurse here. Let's get straight to it. You need to know the difference between what you're gonna do on the nursing floor and what you are going to learn in school. I like to think of it as policy versus procedure. For example, why does the body function the way it is? Why is nutrition so important? Why do you have to take this medication versus this one? It's like you're a little kid. You're asking why this, why that, where, and how. But your parents are your school, and you are basically paying your parents thousands of dollars to teach you why. Procedure is what you learn when you first start your nursing career. Depending on where you work, you'll learn how to deal with certain residents or patients, and you might have to also follow specific guidelines for the facility. I hate to break it to you, but they do not go over those facilities in school.
Facilities in school.
Oh, protocols. Wait, guidelines. Yep. All those hard times trying to memorize each and single acronym that you see online, all your hard work gone. But that's why you're here, right? Right? Okay. Overall, both policy and procedure are completely different, but they work in tangent. In order to follow procedure, you have to know policy. And where do you learn policy, you may ask? In school. First things first, if you are still in school and have not taken your exit exam yet, or you're preparing for the NCLEX, then don't think about being a nurse just yet. Finish school first and pass that NCLEX first. I know some people like to get excited and they want to focus on their nursing career, but please, please, please don't focus on that just yet. Sorry to say, but just because you spend thousands of dollars in school, it does not automatically make you a nurse. You can still fail. Your number one priority is passing. Even if you have not had the best grades throughout the year, you will make it to the finish line. You will graduate, you will pass your NCLEX, and you will become a nurse. Now that I got that out of the way, in school what is that? Psst, now that she's out of the way, I'm E Shorty. I just want to say thank you to Antonia D. Relian 900 for this lovely comment. You will do great on your prereqs. This video is coming soon. So if you're watching this, tell me what other videos we should do. Anyways, I gotta go. Who was that knocking? Ugh. Anyways, you will have a ton of projects and you will need to do a lot of clinical hours. For those who don't know what clinicals are, basically you go to a facility and you shadow a nurse that works there. I would expect to pass some medicine, blood sugars, inject insulin, but sadly you can't do it all because you're just a student. So at the most you'll be watching or just taking notes. During lectures, from my experience looking back at it now, what your instructors will be teaching you may not always be up to date. What you are learning in school and what they are attempting to teach you is all the information you need to get the correct answer on the NCLEX, the exit exam and NCLEX. And sometimes the answer may be totally different to what you would be able to respond to in an emergency situation when you start working. Don't worry though, your facility will go over those protocols for you for those certain situations. They most of the time tell you it beforehand, like before starting in the onboarding process. Like for me, I learned it when I was already signing the papers in the employee handbook. Now fast forward, you pass your NCLEX and you are about to start your first nursing job. Wait, you have to work 12 hours? You have to work graveyard shifts? You have to work holidays? Yes, you do. That is what you signed up for. Let's assume you already know this and you are okay with it. No one is ever fully ready to be a nurse in the beginning, especially if it's your first nursing job. You will just have to learn to be comfortable while still feeling a little uncomfortable. So when you start your first nursing job, of course you're going to be shadowing a nurse. When you shadow someone, do not hesitate to ask questions. Trust me, I asked probably 1,000 questions in just 1 week. Most importantly, be open-minded. Sometimes whenever you're shadowing a different nurse, they would say something like, "This is not how you should do it, but this is how I do it." Or another nurse would be like, "This is how I do it, but this is how you shouldn't do it." Their procedure may be a little different as long as you follow policy. You see how it wraps around together? The best things to do is to learn from your peers because you will start to implement things and change it into your own style. Be prepared because pretty soon you will be the nurse that will be training the new nurses and they will learn from you. And boom, the cycle has started all over again. Alright folks, I hope you found this video informative. Don't forget to hit the like and subscribe button and let me know in the comments what I should talk about next.
All right.
I just said that already.